Hello, my name is Dr. Sam Richardson, and this is the Renal and Bladder video for the Bedside Review series from Mountain View Hospital. As a reminder, these are short videos for rapid review prior to performing point-of-care ultrasound and are not a substitute for full didactic experience. The point-of-care renal and bladder ultrasound is typically performed with a curvilinear transducer. Pathology we are attempting to identify includes hydronephrosis or hydroureter, urinary retention, and confirmation of catheter placement. When performing a renal ultrasound, both kidneys and the bladder should be imaged. Take time to carefully image each kidney, making sure you obtain cuts of the renal pelvis. It is helpful to rotate the probe to 10 o'clock for the right kidney and to 2 o'clock for the left kidney, so that the ultrasound probe fits between the patient's ribs. It is often helpful to have the patient do a deep breath hold to pull the kidneys down below the costal margin. This method is somewhat more effective on the right side. When imaging the bladder, start with the probe in the sagittal orientation and place the bottom end of the transducer so that it abuts the pubic symphysis. The bladder is seen directly superior to the pubic symphysis. If there is concern for retention, take a still in both orientations and measure the size of the bladder. The measurements should form a plus sign on one image and a minus sign on the other. We generally recommend the transverse image contain the plus sign, but as long as the measurements are done correctly, which image you choose does not impact the result. If you are trying to identify a catheter, make sure the balloon is clearly visible. In some cases, it is helpful to backfill the bladder with 50 to 100 cc's of saline.